What if I told you that a man who spent 43 years of his life absolutely convinced that God was nothing more than a fairy tale, a crutch for the weak-minded, would completely transform his entire worldview in a matter of minutes during what should have been a routine surgery? What if I told you that this wasn't some emotional breakdown or psychological episode, but something so profound and undeniable that it would shake the very foundations of everything he thought he knew about reality itself? This is the incredible, true story of Dr. Michael Harrison, a brilliant neurosurgeon who built his entire career on facts, evidence, and scientific reasoning. A man who would openly mock religious colleagues and dismiss any mention of the supernatural as primitive superstition, but whose life would be forever changed by an experience so extraordinary that it would force him to question everything he had ever believed about the nature of existence, consciousness, and what lies beyond the physical world we think we understand. Dr. Harrison wasn't your typical skeptic who simply had doubts about religion. He was what you might call a militant atheist, someone who actively campaigned against what he saw as the dangerous delusions of faith, writing articles for medical journals about the psychological harm caused by religious beliefs, speaking at conferences where he would argue that belief in God was a form of mental illness that humanity needed to evolve beyond, and even going so far as to refuse to work with chaplains in the hospital where he practiced, claiming that their presence was a disservice to patients who needed real medical care, not false hope based on ancient myths and legends. His colleagues knew him as a man of unwavering conviction, someone who had read every major philosophical work on atheism, who could quote Richard Dawkins and Christopher Hitchens from memory, and who had built what he believed was an impenetrable, intellectual fortress around his worldview, one that no amount of emotional manipulation or wishful thinking could ever breach. He had seen death countless times in his 20-year career, had witnessed the final moments of hundreds of patients, and had never once observed anything that suggested consciousness could survive the death of the brain. Nothing that hinted at a soul or an afterlife, or any form of divine intervention in the cold, mechanical processes of biology and chemistry that he understood governed all of life. To Dr. Harrison, the human brain was simply a sophisticated computer made of organic matter. Consciousness was merely an emergent property of complex neural networks, and death was nothing more than the permanent shutdown of these biological systems, after which there was simply nothing. No awareness, no experience, no continuation of the self in any form whatsoever. He had built his entire identity around this materialist worldview, had raised his children to be rational thinkers who wouldn't fall prey to what he called the God delusion, and had even written a book titled The Final Diagnosis: Why Science Proves God is Dead, which had become something of a bestseller among atheist intellectuals, and had earned him invitations to speak at universities around the world about the dangers of religious thinking in modern society. His wife Sarah often worried about the intensity of his anti-religious crusade, not because she was particularly religious herself, but because she could see how it consumed him, how he seemed to take personal offense at the very existence of faith, as if believers were somehow insulting his intelligence simply by maintaining their beliefs in the face of what he considered overwhelming evidence to the contrary. But Dr. Harrison was convinced that he was fighting the good fight, that he was helping to free humanity from the chains of superstition and mythology that had held our species back for millennia, and that his work was contributing to a more rational, scientific future where decisions would be based on evidence rather than ancient texts written by primitive peoples who didn't understand the first thing about how the universe actually worked. He had debated theologians and philosophers, had studied the history of religion with the same intensity he brought to his medical practice, and had concluded that every single religious experience in human history could be explained by psychology, neurology, or simple wishful thinking, that there was no mystery too profound for science to eventually solve, no question too deep for human reason to eventually answer. If you're enjoying this incredible story so far, make sure to hit that like button to let me know you want to hear more amazing content like this. And if you're new to the channel, consider subscribing because we share life-changing stories like this one every single week. Dr. Harrison's confidence in his atheistic worldview was so complete that he often told his medical students that the greatest service they could provide to their patients was to help them face reality without the comforting lies of religion, to help them understand that life was precious precisely because it was finite. That meaning came from human connection and achievement rather than from some imaginary cosmic purpose, and that the sooner humanity abandoned its childish need for a divine parent figure, the sooner we could take full responsibility for our own destiny and create a truly rational civilization based on science, reason, and human compassion, rather than fear of supernatural punishment or hope for eternal reward. This was the man who, on a cold Tuesday morning in February, would walk into an operating room for what he thought would be routine gallbladder surgery, completely unaware that he was about to experience something that would shatter every assumption he had ever made about the nature of reality, consciousness, and the possibility that there might be more to existence than the purely physical world he had spent his entire adult life defending as the only possible truth. Dr. Harrison had been experiencing persistent abdominal pain for several weeks, the kind of dull, nagging discomfort that he initially dismissed as stress-related, tension from his demanding surgical schedule, and the constant pressure of maintaining his reputation as one of the country's leading neurosurgeons. But when the pain began to intensify and radiate toward his right shoulder, in a pattern he immediately recognized as classic gallbladder symptoms, his medical training kicked in, and he knew he couldn't ignore it any longer, though his first instinct was to treat himself rather than submit to the vulnerability of being someone else's patient. The irony wasn't lost on him that after years of telling patients to seek medical attention promptly for their symptoms, he had spent weeks trying to convince himself that his own pain was nothing serious, that he could manage it with over-medications and sheer willpower, because admitting he needed medical care felt like an admission of weakness that didn't align with his self-image as someone who was in complete control of his own destiny through rational thought and scientific knowledge. When he finally scheduled an appointment with Dr. Patricia Chen, a colleague he respected for her no-nonsense approach to medicine and her own skeptical attitude toward anything that couldn't be measured or quantified, the ultrasound results confirmed what he had already suspected. His gallbladder was inflamed and filled with stones, a condition that would require surgical removal before it progressed to something more dangerous like perforation or infection. Dr. Chen recommended laparoscopic cholecystectomy, a minimally invasive procedure that would involve making several small incisions in his abdomen and using a tiny camera to guide the surgical instruments, a routine operation that thousands of surgeons performed every day with minimal risk and excellent outcomes. But she warned him that his case was slightly more complicated than usual because the inflammation had progressed further than typical, meaning the surgery might take longer than expected and would require general anesthesia rather than the regional anesthesia he had hoped might be sufficient. The prospect of being completely unconscious and vulnerable during surgery was deeply unsettling to Dr. Harrison, not because he feared death in any spiritual sense, since he was convinced that death was simply the end of consciousness with nothing beyond it, but because the idea of surrendering control to someone else, of being reduced to an unconscious body on an operating table while others made decisions about his care, triggered a profound anxiety that he struggled to rationalize away. Despite his complete confidence in Dr. Chen's surgical skills and the statistical safety of the procedure, on the morning of the surgery, as he lay on the gurney being wheeled toward the operating room, Dr. Harrison found himself thinking about all the patients he had treated over the years who had expressed fear about going under anesthesia. Patients he had reassured with clinical explanations about how modern anesthesia worked, how the medications simply interrupted the normal functioning of the central nervous system in a controlled and reversible way, how there was nothing mystical or frightening about the process, just chemistry and pharmacology applied with scientific precision. He had always been slightly impatient with patients who asked questions about what they might experience during surgery, who wondered if they would dream or have any awareness, who seemed to harbor superstitious fears about their souls leaving their bodies or having out-of-body experiences, because he knew with absolute certainty that consciousness was simply a product of brain activity, and that when the brain was chemically suppressed, there could be no awareness, no experiences, no memories formed, just a peaceful void that would feel like no time had passed at all when they woke up. The anesthesiologist, Dr. James Rodriguez, was a friendly man who had worked with Dr. Harrison on countless procedures over the years, and who knew about his patient's strong atheistic beliefs, so he kept his pre-surgical conversation focused on the technical aspects of the anesthesia protocol, explaining how he would use a combination of propofol for induction, sevoflurane for maintenance, and a muscle relaxant to ensure complete surgical conditions. all delivered through sophisticated monitoring systems that would track Dr. Harrison's vital signs and adjust the medication levels automatically to maintain the perfect balance between unconsciousness and physiological stability. As the 4 needles slipped into his arm and he felt the cold sensation of the medication entering his bloodstream, Dr. Harrison's last conscious thought was a mixture of scientific curiosity about what his brain was about to experience and the satisfaction that he would soon have first-hand proof that there was nothing mysterious about anesthesia, nothing spiritual about the loss of consciousness, just the predictable result of specific chemicals interrupting specific neural pathways, in exactly the way that modern medicine had learned to control with mathematical precision. The surgery began routinely, with Dr. Chen making the standard incisions and inserting the laparoscopic camera to survey the surgical field. But within minutes, she realized that Dr. Harrison's condition was more complex than the preoperative imaging had suggested. The inflammation was more extensive than expected. There were adhesions connecting the gallbladder to surrounding tissues that would require delicate dissection, and what should have been a straightforward 1-hour procedure was going to take significantly longer and require more aggressive surgical intervention than anyone had anticipated. As Dr. Chen worked to carefully separate the inflamed gallbladder from the liver and surrounding structures, she encountered unexpected bleeding from what appeared to be a small tear in the hepatic artery, a complication that transformed the routine surgery into a potential emergency as blood began to pool in the surgical field faster than the suction devices could remove it. And she quickly realized that she would need to convert from the minimally invasive laparoscopic approach to an open surgical procedure that would give her better access to control the bleeding and repair the damaged vessel. The sudden change in the surgical plan triggered a flurry of activity in the operating room as nurses prepared additional instruments. The anesthesiologist adjusted medication levels to account for the increased stress on Dr. Harrison's cardiovascular system, and Dr. Chen made the decision to call in Dr. Michael Torres, a vascular surgeon who specialized in hepatic procedures, to assist with the increasingly complex case that was now threatening to become life-threatening if the bleeding couldn't be controlled quickly and effectively. What had begun as a routine Tuesday morning surgery had suddenly become a race against time, with Dr. Harrison's blood pressure dropping steadily, despite the anesthesiologist's best efforts to maintain cardiovascular stability, his heart rate becoming irregular as his body struggled to compensate for the blood loss, and the surgical team working with increasing urgency to locate and repair the source of the bleeding before their colleagues' condition deteriorated beyond the point of recovery. All while Dr. Harrison remained completely unconscious and unaware that his life was hanging in the balance in ways that his scientific worldview had never prepared him to imagine. It was during this critical moment, when Dr. Harrison's blood pressure had dropped to dangerously low levels and his heart rhythm had become so erratic that the anesthesiologist was preparing emergency medications to prevent cardiac arrest, that something extraordinary happened that would challenge everything modern medicine thought it understood about consciousness, awareness, and the relationship between the mind and the brain. According to Dr. Harrison's later testimony, at the exact moment when his vital signs were at their most unstable and his brain should have been receiving insufficient oxygen to maintain any form of conscious experience, he suddenly found himself floating above his own body, looking down at the operating table where he could see his physical form, lying motionless while the surgical team worked frantically to save his life, a perspective that should have been impossible given that his eyes were taped shut and his brain was under deep anesthesia. Yet he could see everything with perfect clarity, including details about the surgical procedure that he couldn't possibly have known while unconscious. From this impossible vantage point, he watched Dr. Chen's hands moving with practiced precision as she worked to control the bleeding. Observed Dr. Rodriguez adjusting medications and monitoring equipment, with growing concern evident on his face, and noticed the tension in the room as nurses moved with the efficient urgency that he recognized from his own experience with surgical emergencies. But what struck him most profoundly was not the visual information he was somehow receiving despite being unconscious, but the overwhelming sense of presence that he felt, as if he was not alone in this strange state between life and death, but was being observed by something vast and loving that defied all logical explanation. The experience became even more extraordinary when he began to hear what he would later describe as the most beautiful and terrifying voice he had ever encountered, a voice that seemed to speak directly to his consciousness without using words. in any conventional sense, communicating through pure meaning and understanding in a way that bypassed his rational mind entirely and spoke directly to some deeper part of his being that he hadn't even known existed until that moment. The voice wasn't harsh or judgmental as he might have expected from his years of studying religious texts and dismissing them as primitive attempts to control behavior through fear, but instead carried a quality of infinite compassion and understanding that seemed to encompass not just his own life and struggles, but the entire scope of human experience, as if this presence had witnessed every moment of joy and suffering in human history and loved humanity not in spite of its flaws but because of them, with a depth of acceptance that Dr. Harrison had never experienced from any human relationship. What the voice communicated to him was not a message of condemnation for his years of aggressive atheism or mockery of religious believers, but rather a gentle correction of his fundamental misunderstanding about the nature of reality itself, explaining without words that his scientific materialism had captured only the most superficial layer of existence, like a person who had spent their entire life studying the surface of the ocean while remaining completely unaware of the vast depths teeming with life beneath the waves. The voice helped him understand that his devotion to scientific method and rational thinking had been valuable and important, but that he had made the mistake of assuming that these tools could capture the full spectrum of reality, when in fact they were designed to measure only the physical dimension of existence, leaving him blind to the spiritual dimensions that were not less real but simply operated according to different principles that required different methods of investigation and understanding. Through this communication that transcended ordinary language, Dr. Harrison began to comprehend that consciousness was not merely an emergent property of complex neural networks, as he had always believed, but was actually a fundamental aspect of reality itself, like energy or matter, and that individual human consciousness was connected to a vast network of awareness that encompassed not just all living beings, but the entire universe itself. A understanding that made his previous materialist worldview seem as limited as a child's understanding of mathematics, who had learned to count, but remained unaware that calculus existed. The voice explained that his experience of floating above his body was not a hallucination or a trick of oxygen-deprived brain tissue, but a glimpse into the true nature of his being, showing him that he was not just a temporary arrangement of atoms and molecules that would dissolve at death, but an eternal aspect of consciousness that had existed before his birth and would continue to exist after his physical death, though in ways that his current understanding could barely begin to grasp. If you're finding this story as mind-blowing as I am, make sure you're subscribed to the channel, because we dive deep into incredible real-life experiences like this one every week. And hit that notification bell so you never miss these amazing stories that challenge everything we think we know about reality. The voice continued to communicate with him, showing him scenes from his own life, but from a perspective he had never considered, allowing him to see how his aggressive atheism had been motivated not by pure intellectual honesty as he had always believed, but by a deep fear of vulnerability and a need to maintain control over his environment and his own mortality. Fears that had driven him to reject anything that couldn't be measured or controlled through scientific methods. He was shown moments when his harsh dismissal of patients' spiritual beliefs had caused them additional suffering during already difficult times, instances where his intellectual arrogance had prevented him from offering the kind of compassionate care that healing truly required, and he felt a profound sense of remorse, not for his commitment to scientific truth, but for the way he had used that commitment as a weapon against people who were seeking comfort and meaning in the face of suffering and death. The voice helped him understand that science and spirituality were not enemies locked in eternal combat, as he had always assumed, but were different approaches to understanding different aspects of the same infinite reality, like two people describing the same mountain from different perspectives, each seeing something true and valuable that the other might miss, and that his calling as a physician could be enhanced rather than compromised by recognizing the spiritual dimensions of healing and human experience. Through this impossible conversation that seemed to last both an eternity and an instant, Dr. Harrison began to understand that his entire worldview had been built on a foundation of fear disguised as intellectual superiority, that his need to debunk and dismiss spiritual experiences had been motivated by his terror of acknowledging that there were aspects of existence beyond his ability to understand or control, and that his aggressive atheism had been a desperate attempt to create certainty in a universe that was far more mysterious and wonderful than he had ever dared to imagine. The voice assured him that his scientific training and rational thinking were gifts that would serve him well in his new understanding, but that he would need to expand his definition of evidence to include the direct experience of consciousness itself, and that he would need to develop new forms of courage to explore territories of human experience that couldn't be mapped with the tools of conventional science but were, nonetheless, real and vitally important for human flourishing and understanding. As this extraordinary communication continued, Dr. Harrison felt his perspective shifting in ways that seemed to reorganize not just his beliefs, but his entire sense of identity, as if he was discovering that he had spent his entire life living in a small room while remaining unaware that the room was actually just one chamber in a vast mansion with countless other rooms to explore, each filled with wonders and possibilities that he had never imagined could exist. The transition back to ordinary consciousness was jarring and disorienting for Dr. Harrison, like being suddenly pulled from a vivid dream into harsh fluorescent lighting, except that what he was leaving behind felt more real and substantial than anything he had ever experienced in his waking life, while the recovery room where he found himself seemed strangely flat and insubstantial, as if he was viewing the physical world through a thick layer of glass that muffled both sound and meaning. His first instinct, trained by decades of scientific thinking and reinforced by his professional reputation as a rational skeptic, was to dismiss the entire experience as nothing more than an anesthesia-induced hallucination, a predictable result of oxygen deprivation to the brain, combined with the stress of surgical complications and the powerful cocktail of medications that had been coursing through his system during the most critical moments of the procedure. Dr. Harrison's medical training immediately provided him with an arsenal of explanations that could account for every aspect of his experience without requiring him to abandon his materialist worldview, and he began constructing elaborate theories about how the combination of hypoxia, anesthetic agents, and surgical stress could have triggered the release of endorphins and other neurochemicals that might create the illusion of floating above his body, hearing voices, and experiencing profound spiritual insights that felt utterly convincing despite being nothing more than the brain's desperate attempt to make sense of chaotic neural activity during a life-threatening crisis. He reasoned that his ability to recall specific details about the surgical procedure could be explained by his subconscious mind, processing auditory information that had penetrated his anesthetized state, that his brain had simply woven these fragments of overheard conversation into a coherent narrative that felt like direct observation, and that the profound emotional impact of the experience was nothing more than his psychological defense mechanisms creating a comforting fantasy to help him cope with the trauma of nearly dying on the operating table. The voice that had seemed so real and authoritative could sadly be explained as his own unconscious wisdom, speaking to him in a form that his rational mind would find acceptable, a kind of internal dialogue that his brain had projected outward and personified as a divine presence, because the alternative of acknowledging his own mortality and the limitations of his scientific worldview was too threatening to his sense of identity and control. Dr. Harrison spent hours in his hospital bed researching near-death experiences on his laptop, reading every scientific paper he could find that offered materialist explanations for the phenomena he had experienced, and he was relieved to discover that researchers had identified numerous neurological mechanisms that could account for out-of-body experiences, mystical visions, and encounters with deceased relatives or spiritual beings, all of which could be understood as predictable responses of the brain under extreme stress, rather than evidence of any supernatural or spiritual reality. He found studies showing that electrical stimulation of specific brain regions could reproduce many of the classic features of near-death experiences, research demonstrating that the release of endorphins and other neurochemicals during cardiac arrest could create profound feelings of peace and transcendence, and theoretical frameworks that explained how the dying brain might construct elaborate narratives to maintain psychological coherence in the face of impending dissolution. The more Dr. Harrison read, the more confident he became that his experience, however vivid and emotionally powerful, was simply an interesting example of how the human brain responds to extreme physiological stress, and he began to feel embarrassed that he had allowed himself to be so deeply affected by what was obviously nothing more than a chemically induced hallucination brought on by surgical complications and anesthetic drugs. When Dr. Chen visited him during her rounds, he casually mentioned that he had experienced some unusual dreams during the surgery, carefully avoiding any language that might suggest he was taking the experience seriously, and he was relieved when she nodded knowingly and explained that patients frequently reported strange experiences during complex procedures, especially when there were complications that required extended time under anesthesia or periods of cardiovascular instability. Her matter-of-fact explanation that these experiences were common and well understood medical phenomena helped reinforce his conviction that he had been foolish to allow himself to be so shaken by what was clearly just an interesting neurological curiosity, and he began to construct a more elaborate intellectual framework to explain away every aspect of his experience that had initially seemed so convincing and transformative. He told himself that his years of studying religious texts and philosophical arguments had simply provided his unconscious mind with a rich vocabulary of spiritual concepts and imagery that his brain had drawn upon to construct a convincing but ultimately meaningless narrative during the crisis. That his knowledge of patient psychology had allowed him to anticipate what kind of mystical experience would feel most authentic and compelling, and that his own deep-seated fears about death and meaninglessness had motivated his brain to create exactly the kind of comforting fantasy that would provide temporary relief from his existential anxiety. The fact that the voice had seemed to address his specific concerns about science and spirituality, rather than delivering generic religious platitudes, simply proved that his own mind had been the source of the communication, drawing upon his extensive knowledge of theological debates and philosophical arguments to create a sophisticated internal dialogue that felt like revelation but was actually just sophisticated self-deception. Dr. Harrison became increasingly irritated with himself for having been so emotionally affected by what he now recognized as a perfectly ordinary medical phenomenon, and he began to worry that his reputation as a rational skeptic might be damaged if any of his colleagues learned that he had been temporarily shaken by an anesthesia-induced hallucination. So he made a conscious decision to put the entire experience behind him and return to his normal life and worldview as quickly as possible. He threw himself into his work with renewed intensity, taking on additional surgical cases and research projects as a way of proving to himself that his commitment to scientific materialism remained as strong as ever, and he began planning to write a paper about his experience that would demonstrate how even the most vivid and emotionally convincing mystical experiences could be explained through conventional neuroscience and psychology without requiring any supernatural or spiritual explanations. The more time that passed, the more distant and dreamlike his surgical experience became, and he began to convince himself that his memory of the event was probably distorted by the trauma and medications, that he was likely remembering things that hadn't actually happened or inflating the significance of mundane sensory experiences that had occurred during his emergence from anesthesia. If this story is resonating with you, please give it a thumbs up and let me know in the comments what you think about Dr. Harrison's struggle to rationalize his experience. And don't forget to subscribe if you want to see how this incredible journey continues to unfold. He started to feel proud of his ability to resist the temptation to embrace irrational beliefs, even when they were presented in such a compelling and emotionally satisfying package, and he saw his successful return to atheistic materialism as evidence of his intellectual integrity and emotional maturity, proof that he was strong enough to face reality without the comforting delusions that weaker minds required to cope with the harsh truths of existence. Dr. Harrison began to use his experience as ammunition in his ongoing campaign against religious belief, telling colleagues that his temporary confusion during the surgical crisis had given him valuable insight into how easily the human mind could be tricked into accepting supernatural explanations for perfectly natural phenomena, and he started incorporating his story into lectures and presentations as an example of how even highly educated and scientifically trained individuals could be vulnerable to mystical thinking when their brains were compromised by stress, trauma, or chemical influences. However, despite his intellectual confidence and his successful return to his previous worldview, Dr. Harrison found himself struggling with subtle but persistent changes in his emotional and psychological state that he couldn't easily explain or dismiss, a lingering sense that something fundamentally important had been lost when he rejected his surgical experience, and a growing feeling of emptiness and disconnection that seemed to deepen rather than fade as time passed, and his memory of the voice and the profound sense of love and understanding it had conveyed became increasingly distant and abstract. The turning point came 3 months after his surgery when Dr. Harrison found himself unable to sleep for the 4th consecutive night. Lying in bed staring at the ceiling while his mind churned with questions he couldn't silence and doubts he couldn't rationalize away, no matter how many scientific explanations he marshaled or how many peer-reviewed studies he cited to himself about the neurochemical basis of mystical experiences. The persistent emptiness that had been growing inside him since his return to normal life had become so overwhelming that he could no longer ignore it or attribute it to post-surgical depression or the natural psychological aftermath of a medical crisis, because this wasn't the kind of sadness or anxiety that could be treated with medication or therapy, but rather a fundamental sense that his entire understanding of reality was somehow incomplete, like a jigsaw puzzle that appeared complete until you realized that crucial pieces were missing from the center. His wife Sarah had noticed the changes in him, the way he seemed distracted during conversations, the loss of his usual passionate engagement with his atheistic crusade, and his growing irritability with patients who asked spiritual questions, as if their inquiries were somehow triggering uncomfortable memories or doubts that he was working hard to suppress. She had gently suggested that maybe his near-death experience had been more significant than he was willing to admit, that perhaps his aggressive dismissal of the event was actually a form of psychological defense against truths that challenged his fundamental worldview. But he had responded with such vehemence and detailed scientific explanations that she had backed away from the topic, though she continued to watch him with growing concern as he became increasingly isolated and disconnected from the passions that had once defined his identity. The breaking point came during a particularly difficult case when Dr. Harrison was treating a young mother who had been diagnosed with an aggressive brain tumor, and as he explained the grim prognosis and limited treatment options, she had looked at him with tears in her eyes and asked if he believed there was any hope beyond what medical science could offer, any possibility that death might not be the absolute end of consciousness and connection that he had always proclaimed it to be. For the first time in his career, Dr. Harrison found himself unable to deliver his usual confident dismissal of such concerns, because the memory of the voice and the profound sense of love and continuity he had experienced during his own brush with death suddenly felt more real and immediate than all the scientific theories he had used to explain it away, and he realized that his patient was asking him about the very questions that had been haunting his own sleepless nights for months. Instead of offering his typical materialist reassurances, he found himself saying quietly that he didn't know, that there might be aspects of consciousness and existence that science hadn't yet learned to measure or understand, and the look of hope and gratitude in the woman's eyes affected him so deeply that he had to excuse himself from the room to compose himself, shaken by the realization that his rigid atheism might have been depriving his patients of comfort and hope that could genuinely help them face their suffering with greater courage and peace. That night, driven by a desperation he barely understood, Dr. Harrison did something he would never have imagined possible 6 months earlier. He began to seriously research spiritual and religious perspectives on consciousness, death, and the nature of reality, not as an intellectual exercise in debunking superstition, but as a genuine seeker trying to understand whether there might be truth in traditions and experiences that his scientific training had taught him to dismiss as primitive delusions. He started by reading the works of scientists and physicians who had undergone similar transformations. People like Dr. Eben Alexander, a Harvard neurosurgeon who had written about his own near-death experience, and Dr. Raymond Moody, who had pioneered the scientific study of near-death experiences and argued that they represented genuine encounters with non-physical dimensions of reality rather than mere hallucinations. He was surprised to discover that there were numerous highly credentialed researchers who had concluded that consciousness might indeed survive bodily death, that there were peer-reviewed studies suggesting that some near-death experiences contained verifiable information that patients couldn't have obtained through normal sensory channels, and that the materialist assumptions he had always taken for granted were actually philosophical positions rather than established scientific facts. Dr. Harrison found himself particularly drawn to the work of Dr. Pim van Lam, a Dutch cardiologist who had conducted a large-scale prospective study of near-death experiences in cardiac arrest patients and had concluded that consciousness appeared to operate independently of brain function, at least under certain extreme circumstances, and that the experiences patients reported were too consistent, and detailed, to be dismissed as random hallucinations or wishful thinking. The more he read, the more he began to realize that his dismissal of spiritual experiences had been based not on overwhelming scientific evidence, but on philosophical assumptions about the nature of reality that he had never seriously questioned. Assumptions that were deeply embedded in his medical training and professional identity, but were not necessarily supported by the full range of available evidence. He began to explore contemplative traditions from various cultures, reading works by mystics and spiritual teachers who had spent lifetimes investigating the nature of consciousness through direct experience rather than external measurement. And he was startled to discover that many of their descriptions of spiritual reality resonated powerfully with his own surgical experience, as if they were describing the same territory he had glimpsed during his encounter with the voice. The writings of contemporary spiritual teachers like Eckhart Tolle and Ajahn Shanti, who described awakening experiences that involved a fundamental shift in the perception of identity and reality, seemed to offer a framework for understanding his own transformation that was both psychologically sophisticated and spiritually profound, helping him see that his crisis wasn't a sign of mental weakness or intellectual failure, but rather a natural response to encountering dimensions of existence that his previous worldview had been unable to accommodate. Dr. Harrison began attending meditation classes and spiritual workshops, initially feeling awkward and self-conscious among people who seemed comfortable with concepts and practices that still triggered his scientific skepticism, but gradually finding that the direct experience of meditation and contemplative practice was providing him with insights into the nature of consciousness that no amount of theoretical reading could have conveyed. He discovered that when he quieted his analytical mind and simply observed his own awareness, he could access states of consciousness that felt remarkably similar to what he had experienced during his surgery. States of peace and clarity that seemed to reveal the artificial nature of the boundaries between self and other, between mind and matter, between the scientific and spiritual dimensions of existence. Make sure to hit that like button if you're as fascinated by Dr. Harrison's journey as I am, and subscribe to the channel because we're going to explore even more incredible transformations like this one in future videos that you won't want to miss. Through months of intensive study and practice, Dr. Harrison began to develop a new understanding of reality that integrated his scientific knowledge with his spiritual insights, recognizing that both approaches were valuable tools for exploring different aspects of the same infinite mystery, and that his previous either-or thinking had been unnecessarily limiting his ability to serve his patients and live with authenticity and purpose. He started to see that his surgical experience had been an invitation to expand his worldview rather than abandon his scientific training, and that the voice he had encountered was not asking him to reject rational thinking, but to recognize its limitations and complement it with other ways of knowing that could access truths that pure analysis could never reach. As his understanding deepened, Dr. Harrison began to feel a profound sense of gratitude for the crisis that had shattered his old certainties and opened him to possibilities he had never imagined, and he realized that his journey toward a more integrated understanding of reality was not a betrayal of his scientific training but rather its fulfillment, allowing him to serve his patients with both clinical expertise and spiritual wisdom, both rational analysis and compassionate presence, both technical skill and genuine love for the mystery of human consciousness, and the profound courage required to face suffering and mortality with grace and hope. The moment of Dr. Harrison's complete transformation came not through any dramatic revelation or mystical experience, but through a quiet recognition that occurred during his morning meditation practice nearly a year after his surgery, when he suddenly realized that he no longer felt the need to choose between his scientific knowledge and his spiritual insights, that the internal war between his rational mind and his intuitive wisdom had finally ended, and that he had somehow become a completely different person while remaining fundamentally the same dedicated physician he had always been. It was as if two separate streams of understanding had gradually merged into a single river of awareness that flowed through every aspect of his life, informing his medical practice with compassion and depth, while grounding his spiritual insights in practical service to others, and he felt a profound sense of coming home to himself in a way that he had never experienced during his decades of militant atheism or his months of confused seeking. The transformation was evident, first in his relationship with his patients, who began to notice that Dr. Harrison brought a different quality of presence to their interactions, a deeper level of listening and understanding that seemed to address not just their physical symptoms but their emotional and spiritual needs as well, without ever compromising his commitment to excellent medical care or imposing his beliefs on anyone who wasn't interested in exploring the spiritual dimensions of healing. He found that his new understanding of consciousness and the interconnectedness of all existence allowed him to connect with patients on a level that was both more professional and more personal than ever before, because he could now see each person as a unique expression of the same divine consciousness that he had encountered during his own near-death experience, which filled him with genuine love and respect for every individual who came to him for care. Patients began to comment on the change in Dr. Harrison's demeanor, saying that he seemed more present and attentive, that his explanations of medical procedures were clearer and more compassionate, and that they felt heard and understood in ways that went beyond the typical doctor-patient relationship, though he was careful never to proselytize or pressure anyone to share his spiritual beliefs, instead simply offering his full presence and allowing his transformed consciousness to express itself through the quality of his care rather than through religious rhetoric or philosophical arguments. His colleagues noticed the change as well, observing that Dr. Harrison had somehow become both more confident and more humble, more skilled in his surgical techniques and more collaborative in his relationships with other medical professionals, as if his spiritual awakening had actually enhanced rather than diminished his capabilities as a physician and a leader in the medical community. The transformation extended to his family life as well, where Sarah observed that her husband had become more present and emotionally available, more interested in deep conversations about meaning and purpose, and more willing to acknowledge the limitations of his knowledge and the mystery that surrounded every aspect of human existence, changes that brought them closer together and created a new intimacy based on shared wonder rather than shared skepticism. Dr. Harrison found that his relationship with his children had also deepened significantly, because he could now engage with their natural curiosity about spiritual questions without feeling the need to shut down their inquiries with materialist explanations. And he discovered that his willingness to explore these mysteries alongside them had created opportunities for connection and growth that had been impossible when he felt compelled to have all the answers. The professional transformation was perhaps most evident in Dr. Harrison's approach to terminal cases, where he had once focused exclusively on clinical interventions and prognosis, but now found himself able to address the deeper questions about meaning and continuity that patients and families naturally raised when facing death, offering comfort and hope that was grounded in both medical expertise and spiritual wisdom, rather than false reassurances or religious platitudes. He began collaborating more closely with hospital chaplains and social workers, recognizing that healing involved much more than technical medical interventions, and that his role as a physician was most effective when it was part of a holistic approach that addressed the physical, emotional, and spiritual dimensions of human suffering and recovery. Dr. Harrison's new understanding of consciousness and reality also led him to approach his surgical practice with a deeper sense of reverence and responsibility, recognizing that every operation involved not just the manipulation of physical tissues, but the care of a conscious being whose experience and well-being extended far beyond the boundaries of their physical body. And this awareness made him both more skilled and more compassionate in his technical work. He began to incorporate brief moments of meditation and intention setting into his pre-surgical routine, not as religious ritual, but as a way of centering himself and connecting with the deeper purpose of his work. And he found that this practice enhanced his focus and intuition during complex procedures, while also helping him maintain emotional balance when dealing with difficult cases or unexpected complications. The transformation was also evident in Dr. Harrison's teaching and mentoring of medical students and residents, where he now emphasized the importance of seeing patients as whole human beings, rather than collections of symptoms or interesting cases, and he encouraged young doctors to develop both their technical skills and their capacity for empathy and presence, arguing that the best physicians were those who could integrate scientific knowledge with genuine human understanding. His lectures began to include discussions of the psychological and spiritual dimensions of healing, topics that had once seemed irrelevant or even harmful to his materialist worldview, but which he now recognized as essential components of truly effective medical care. And his students responded with enthusiasm to his more holistic approach to medicine and his willingness to acknowledge the mysteries and limitations inherent in human understanding. Dr. Harrison also began writing and speaking about his transformation, not as a religious convert trying to persuade others to abandon science, but as a physician who had discovered that the deepest scientific inquiry naturally led to questions that required spiritual as well as rational investigation. And his presentations at medical conferences and his articles in professional journals began to explore the intersection of consciousness research, near-death experience studies, and clinical medical practice. If you're inspired by Dr. Harrison's incredible transformation, please share this video with someone who might benefit from hearing this story, and let me know in the comments how this journey has affected your own thinking about the relationship between science and spirituality. He found that his story resonated with many other healthcare professionals who had experienced similar awakenings, or who were struggling with the limitations of purely materialist approaches to healing, and he began to serve as a mentor and guide for other physicians who were exploring the integration of spiritual wisdom with medical practice, helping them navigate the challenges of maintaining professional credibility while honoring their deepest insights about the nature of consciousness and reality. The transformation was complete when Dr. Harrison realized that he no longer thought of himself as someone who had abandoned atheism in favor of religious belief, but rather as someone who had moved beyond the artificial boundaries between scientific and spiritual ways of knowing, recognizing that both approaches were necessary tools for exploring the infinite mystery of existence, and that true wisdom came not from choosing one perspective over another, but from developing the capacity to hold multiple ways of understanding in creative tension while remaining open to new insights and discoveries. His life had become a living demonstration that the highest scientific inquiry and the deepest spiritual understanding were not enemies but allies in the quest to understand reality and serve others with skill, compassion, and reverence for the profound mystery of consciousness that connected all beings in an invisible web of love and mutual dependence that extended far beyond the boundaries of individual existence. 5 years after his life-changing surgical experience, Dr. Harrison found himself sitting in the same hospital chapel that he had once walked past with dismissive contempt. But now, he came here regularly, not for religious worship in any traditional sense, but as a quiet space for reflection and gratitude, where he could contemplate the extraordinary journey that had transformed him from a militant atheist into someone who lived with profound reverence for the mystery of existence while maintaining his commitment to rigorous scientific inquiry and excellent medical care. The chapel had become a symbol of his transformation, representing his evolution from someone who saw spiritual spaces as monuments to human delusion into someone who recognized them as important sanctuaries where people could connect with the deepest dimensions of their being and find strength to face the challenges of mortality, suffering, and the search for meaning that defined the human experience. As he reflected on the changes in his life, Dr. Harrison marveled at how his near-death experience had initially seemed like a crisis that threatened to destroy his entire worldview and professional identity, but had actually been the beginning of a journey toward a more integrated and fulfilling way of being that enhanced rather than diminished his effectiveness as a physician, his connections with other people, and his sense of purpose and joy in daily life. His medical practice had been transformed in ways that surprised even him, as patients began seeking him out, not just for his surgical skills, but for his ability to address their deeper concerns about meaning, mortality, and the spiritual dimensions of healing. And he found that his willingness to engage with these questions had actually made him a more effective physician rather than less scientific, because he could now address the full spectrum of human needs that influenced recovery and well-being. The integration of scientific knowledge and spiritual wisdom had led Dr. Harrison to develop innovative approaches to patient care that addressed not just physical symptoms but the emotional and existential concerns that often played crucial roles in healing. And he had begun collaborating with researchers at major medical centers to study the relationship between consciousness, spirituality, and medical outcomes, contributing to a growing body of evidence that suggested the importance of addressing patients' spiritual needs as part of comprehensive healthcare. His reputation in the medical community had evolved from that of a skilled but narrowly focused surgeon to that of a physician-philosopher, who represented a new model of medical practice that honored both scientific rigor and spiritual depth. And his lectures and writings had influenced a generation of healthcare professionals to consider the broader implications of their work and the importance of treating patients as whole human beings, rather than collections of symptoms to be managed. Dr. Harrison's family life had been enriched in ways that he could never have imagined during his atheist years, as his relationship with Sarah had deepened through their shared exploration of spiritual questions and their mutual commitment to living with greater authenticity and purpose. And his connections with his children had become more meaningful, as he learned to engage with their natural curiosity about life's mysteries, without feeling compelled to shut down their inquiries with materialist explanations. The transformation had extended to his friendships and professional relationships as well, as he found himself drawn to people who shared his interest in exploring the intersection of science and spirituality, and he had developed a network of colleagues and collaborators who were working to bridge the artificial divide between rational inquiry and contemplative wisdom that had dominated academic and medical institutions for so long. His writing had evolved from aggressive attacks on religious belief to thoughtful explorations of consciousness, near-death experiences, and the integration of scientific and spiritual approaches to understanding reality, and his books had found audiences among both healthcare professionals and general readers, who were seeking more holistic approaches to healing, meaning, and personal growth. Dr. Harrison had also become involved in training programs for healthcare professionals that emphasize the importance of developing both technical skills and emotional intelligence, teaching physicians and nurses how to provide care that addressed the full spectrum of human needs, while maintaining the highest standards of scientific rigor and clinical excellence. The profound sense of purpose that had emerged from his transformation had led him to establish a foundation that supported research into consciousness studies, near-death experiences, and the integration of spiritual practices into medical care. And he had become a leading advocate for healthcare policies that recognized the importance of addressing patients' spiritual and emotional needs as essential components of effective treatment. His public speaking had evolved from debates with religious believers to collaborative discussions with scientists, theologians, and philosophers about the nature of consciousness, the possibility of survival after death, and the practical implications of taking spiritual experiences seriously in academic and medical contexts. And he had found that his story resonated with audiences who were seeking more integrated approaches to understanding the mystery of human existence. The most profound change in Dr. Harrison's life was the deep sense of peace and gratitude that had replaced the anger and intellectual arrogance that had characterized his atheist years, and he often reflected on how his near-death experience had been not just a glimpse of spiritual reality, but a profound lesson in humility that had taught him the importance of remaining open to new possibilities and recognizing the limitations of any single approach to understanding the infinite complexity of existence. His daily meditation practice had become a source of strength and clarity that informed every aspect of his work and relationships, and he had discovered that the regular cultivation of inner stillness and awareness had actually enhanced his ability to think clearly, make good decisions, and respond to challenging situations with wisdom and compassion rather than reactive emotion or intellectual defensiveness. Dr. Harrison's story had become an inspiration to many people who were struggling with questions about the relationship between science and spirituality, and he regularly received letters from individuals who had read his books or heard his lectures and found encouragement to explore their own spiritual experiences without abandoning their commitment to rational inquiry and intellectual honesty. The hospital where he worked had become a model for integrating spiritual care with medical treatment, and other healthcare institutions had begun implementing similar programs that recognized the importance of addressing patients' existential concerns and supporting their spiritual needs as essential components of comprehensive healing, rather than optional extras that could be ignored or delegated to chaplains and social workers. As Dr. Harrison looked back on his journey from militant atheism to integrated spirituality, he felt profound gratitude, not just for the near-death experience that had initiated his transformation, but for the entire process of questioning, searching, and discovering that had led him to a way of being that honored both the rigorous pursuit of knowledge and the humble recognition of mystery, both the practical demands of medical practice and the deeper calling to serve others with genuine love and compassion. If this incredible story has moved you or changed your perspective in any way, I'd love to hear about it in the comments below. And please consider subscribing to our channel and sharing this video with others who might benefit from hearing about Dr. Harrison's remarkable journey from skepticism to spiritual awakening. His life had become a testament to the possibility that human beings could transcend the artificial boundaries between different ways of knowing and create lives of service, meaning, and joy that integrated the best insights from both scientific and spiritual traditions. And he often told his students that the greatest discovery of his career had not been any medical breakthrough or surgical innovation, but the recognition that consciousness itself was the fundamental mystery that connected all aspects of existence, and that approaching this mystery with both intellectual rigor and spiritual reverence was the key to living with authenticity, purpose, and deep satisfaction. The voice that had spoken to him during his surgical crisis had kept its promise to show him a more complete understanding of reality, and Dr. Harrison's life had become a continuous expression of gratitude for the gift of that expanded awareness, and a commitment to sharing its practical benefits with everyone whose lives he touched through his medical practice, his teaching, his writing, and his simple presence as a human being who had learned to live with both scientific precision and spiritual depth.